In today's video, we're going to talk about intra-abdominal pressure monitoring. So in order to perform this, you're going to have to receive an order for a Foley catheter if your patient already does not have one. You will need a pair of clean gloves, a leveler ruler. You will need your cord for your monitor, alcohol prep pads, a 30 ml syringe, 500 of normal saline, and also, last but not least, the TransPac monitoring kit. Now this TransPac is the one without the blood collection syringe on it. So when you open up your kit, you just want to make sure that there is no collection syringe. So when you set up your system for the intra-abdominal pressure monitoring, you're going to have your 500 normal saline bag. One thing that you will notice is there is no longer pressure bag. This is not something that is recommended for practice anymore for intra-abdominal pressure monitoring. So once you spike it with your TransPac cable, you are then going to apply it to the manifold. Prime through your tubing, replace your caps, and then once you come down to the stopcock that is closest to the patient, you are going to attach the 30 ml syringe. After your system is all primed and ready to go, just make sure you attach your cable monitor to your patient monitoring system that is in the patient's room. Now you're going to hook up your monitoring system to the patient. So you have your Foley catheter. You are now going to clean off the port, scrub the hub, allowing it to dry for 30 seconds, and then you will connect your tubing right to the Foley catheter. Now we're going to get ready to shoot our number. Before we measure out our patient to level them out at the iliac crest, we want to make sure that they are supine or flat as they can tolerate or possible. If the patient is intubated, you do want to make sure that they are adequately sedated, so they're not fighting the whole time or moving around. You want to make sure that your patient is still as possible. You want to make sure that the patient is level to your manifold. So the next thing you're going to do is you're going to take your leveler and you're going to place it right on the patient's iliac crest against your manifold until you are leveled in the center. Once you are leveled, now you are ready to shoot your numbers. The next thing that you're going to do is you're going to look at your Foley. You want to make sure that there's any urine in the tube, that you gently remove it, and then we're going to occlude the tube. So whatever that we instill into the bladder is not going to come back out. So for today, we're just going to use a rubber band to occlude our tube. All right, we're going to come up to our syringe. We're now going to take our stopcock and turn it off towards the patient. We're going to go up to our TransPac and then gently press and pull back on our syringe at the same time. As you are doing this, you want to ensure that your syringe is filling up to 25 mLs only. So do not go over that 25. Okay. Once our syringe is completely filled, we're going to take our stopcock to open it towards the patient. So it is now off towards my bag of normal saline. Now we're going to push in our fluid. And then we're going to wait about 30 to 60 seconds as we watch our monitor. And what we're looking for is what our results is going to be. So we're measuring this on end expiration. And now that we got our number, one important thing that we want to make sure that we do when we're all done, we want to remove the occluded line. So whatever fluid that we did instill into the patient, it is now going to flow back out. The last thing that we want to do is keep that catheter occluded and cause the patient any other issues or complications. Once we're all done, you just want to turn off towards the syringe. You don't have to remove the whole intra-abdominal monitoring setup just in case there are further numbers that need to be shot. Then we could just keep the set all together to limit exposure, opening the patient back up and increasing the patient's risk for infection. After you shoot your numbers, you're just going to look to see what millimeter of mercury pressure that you came out with. So there are different grades according to what your results are. So it should start being concerning if you are at a grade 1, so that's anything 12 to 15. A grade 2 is 16 to 20. A grade 3 is 21 to 25, and a grade 4 is anything over 25. With our documentation, In Epic, you want to make sure that you open up your hemodynamic values, and you want to flow in the bladder intra-abdominal pressure. This is where you will document your number. This concludes your video for intra-abdominal pressure monitoring. At the end of shooting your numbers, please be sure to subtract the amount of normal saline that you had stilled into your patient. So if you did one number, then you would subtract 25. And if you reshot it, then you want to make sure that you subtract 50.